Hello, everyone. Thank you so much for being here with us today. So, right now, we're going to sort of dissect and summarize some of the things that you guys found as priorities in terms of what was written on the walls. So, before we do that, actually, we're going to move these posters to a visible area where we can engage all together. Um, at one time. So please bear with us. And the reason why this exercise is extremely important for us is to actually gauge, from what it is you guys were thinking about throughout the day, because your input is extremely important as well as active listeners. So thank you. Please bear with us as we count um, the number of dots in each point.
Okay, it's interesting. We have let's see, Nixon. We can split this. I'm gonna read a couple here. So from here, we have 16 votes on this one, which is conduct special sub-analysis when national surveillance systems do not allow for more in-depth examination. Okay, that's one of the one. Okay, conduct special sub-analysis when when national surveillance systems do not allow for more in-depth examination. Okay? Yes. This one has 13. Importance of ethics analysis, of data collection, analysis, interpretation, reporting, dissemination, health interventions, I'm sorry. What about there, Nixon?
So number 12 here shows um, about 15 green dots, which showed a high level of importance from the points that were gathered today. And that one reads collection of LEP data in public health and clinical settings and in national surveys. So this was very, very, very important. Like LEP, I did not know any information about how much of a problem that was and how much of that is contributing to why the Hispanic Latino population is not actually receiving the healthcare um, services that they're actually deserving of. So I think that was very, very informative from Dr. Flores.
So now I think we probably need Dr. Warren and Dr. Libur for the concluding remarks.
So after that, we're gonna open it up to them so they can actually do a dissection of everything that had happened today, and we would like to hear from you guys about what it is that you guys thought about throughout the day. Thank you for being here.
If this is going to be shared and okay. Oh, okay.
So everyone, I believe we're at that part of the agenda where it says it's our partners' final thoughts. And so I wanted to ask Marcella to come up because she's going to offer a final thought, and also Kim Williams. Let me just say that all of our notes today, the priorities, we will be capturing those. Um, and we actually will be working with the National Alliance for Hispanic Health to develop an executive summary of the whole meeting. We will be speaking to all of our presenters to get permission to share their presentations. There's a huge amount of interest in that. But I also want to say, just in terms of my final thoughts, this has been a phenomenal day for me personally, for the Office of Minority Health and Health Equity, and for the Centers for Disease Control and Prevention. I want to thank our partners in the Planning Committee for having worked diligently for more than 6 months. We've actually been preparing for today. And I hope that everyone who is still in the room and those who are participating with us virtually have reaped benefits from this time together. This is not an exercise for us. It is a call for action to us. Our chair of the Health Disparities Subcommittee, which is a federal advisory committee to the director, said she will be bringing this up in our meeting next week with the subcommittee. And so I want to thank you for the thoughtfulness and the heart that everyone brought to this event today. And I also want to tell you that if you have a newsletter, if you blog, if you tweet, just talk about today. Tell everybody, how you felt about it. Share with your superiors that this was a day well spent. And, our work is cut out for us, but I want you to know that you were heard, and we will do all that is within our power within the Office of Minority Health to help to move this agenda forward. So I want to say thank you very much and have Marcella come up.
And I just want to say thank you on behalf of the National Alliance for Hispanic Health for having us here. And one of the things that I find very uplifting and exciting is to see the younger scientists already thinking about what to do and how to apply what they learned today. So I'm waiting to see the next research results that you guys will produce. We will be like with the perfect information, all inclusive. And so I'm waiting for that right now. No pressure, of course, no pressure. So thank you, everyone. Let's share when we get, I guess, the proceedings, or when we get the final report from the meeting, make sure you share that with everyone as much as possible. Yes, yeah, that's coming up. They're coming up. I'm just giving a little preview of what we're going to be sharing. So thank you, everyone, again. And then if you come to Washington, D.C., look us up there, the National Alliance for Hispanic Health. Thank you.
Good afternoon. My name is Ken Williams. I'm the Deputy Director of the Office of Minority Health and Health Equity. So basically that means that I'm the one that takes Dr. LeBeur's big brain and try to create an operationalized process to make everything work. So my remarks are going to be very brief. This event is an excellent follow-up to our last year's event, refining what we mean by ethics in public health, how ethnicity, race, and place matters when analyzing data, and the challenges that we must consider in the context of Latino and Hispanic health. The feedback gathered today will inform the special Tuskegee University bioethics supplement and will result from this symposium. We encourage you to visit the OMHHE as well as Tuskegee University ethics websites for any of the updates that we're placing on there. That being said, the next ethics forum will take place here this time next year, April 2017. We will send everyone who registered for this event, as well as our other partners, more information in the coming months. The focus will be on Asian Americans, Native Hawaiians, and Pacific Islanders. Working together, we can achieve health equity. Therefore, stay tuned, but there is more to come. Thank you.
The exciting part for me is to see the result of the student and residents' presentations. So I know you don't want to hear what I have to say. I want to hear what they have to say. And I want to do one thing before I ask Dr. Gerby to come forth and tell us exciting winners. Last year, we, as a result of this Public Health Ethics Forum, we published a special edition in the journal. Tuskegee has a peer-reviewed journal, and we published some of the papers for those who were willing, and also the student papers. And there were some other articles in there as well. We intend to publish the proceedings next year, this year in December, in our journal, and it'll be available electronically and a certain number of hard copies as well. And some of it, if not all of it, will also be published in Spanish. So that's going to be a real challenge and a new one for us, but it's important. It's very, very important. And it's also going to be electronically available at no charge, so it should go to the world. So I'll have another few remarks in closing, but I want to ask Dr. Gerby to come forth to talk about the poster presentation result. And this is this CDC, Tuskegee, Morehouse School of Medicine collaboration partnership that will be going on probably forever. Dr. Gerby.
Good afternoon. My name is Gamechu Garbi from Morehouse School of Medicine. I'm here to announce 2016 Public Health Ethics Forum poster presentation winners. First, before I do that, I would like to thank all of our poster presenters. And their colleagues for sharing the research at this symposium, and all of you guys did a great job, and congratulations again. Second, we thank our judges for evaluating the poster presentations. Evaluation was based on organization and the layout, the content, oral presentation, and posters. After tallying all of the scores, we are excited to announce the top 3 judged presentation to be published in the Journal of Healthcare Science and the Humanities. So I'm gonna call 3 top winners, and all of them are, please, required to come here to take a picture, right? So I'm gonna start from the first place. The first place winner is Celine Craig from Morehouse School of Medicine. Can you come over? Second place is a tie. So it is so interesting because our judge, they told me that it's really difficult to give them a score because all of them were just outstanding. But we have tied. Second place, Alexandria Banks from Charles Drew University of Medicine and Science. Another second place is Tam Yuen from Mehari Medical College. Tam. The third place is Sabianka Devla from John Hopkins School of Nursing. All of you guys come here, congratulations. And I would like to ask Dr. Warren to come picture with them. Congratulations.
And Dr. LeBert, please join us so we can get this photo. All right. We're going to close in 2 minutes on time. We came here to talk about a different way of looking at data, because the way we've been looking at it has not been helpful enough. Not helpful enough. So I don't want to suggest that it hasn't been helpful. It has, just not enough, using outcomes as a criteria. And what we suggested that if we use a different lens, we may see a different picture. If we use a different lens, we may see a different picture. We did, I think, separate or expand what some have been historically used as bioethics as a framework to suggest that there's another framework, particularly in public health. It's called public health ethics, an evolving sphere of ethics, a way to look at populations, a way to understand justice at one level, but social justice at another level, a way to look at the individual at one level, but the population at another level, a way to look at autonomy at one level, but engagement, community engagement at another level. So we're not suggesting either or, we're suggesting both and. And in my closing 30 seconds, I want to give you a framework to look at public health ethics. What are the facts? Because the facts seem to change all the time. What are the facts as you see them through that public health ethics lens? Who are the stakeholders? And if you think that the Hispanic population, the Latino population are the only stakeholders around Latino Hispanic health, you're badly mistaken. Who are the stakeholders? What are we going to do? Evidence-based, ideally, but if not evidence-based, at least set up some way of evaluating what you've done. What are we going to do? And the last and most important question, what are the consequences if we do nothing? Now, that's not a made-up framework. That's a framework that works in public health ethics. The facts, the stakeholders, what are we going to do, and what are the consequences if we do nothing? So on that note, I want to thank everybody for coming. I'd like the planning committee to stand up that really put this forum together. Please stand, because we met almost every week. Discussed most times, fussed sometimes, and on occasion even cussed. But the result was this forum, wonderfully planned and wonderfully executed. And I want to also thank CDC, because it's real special to come to CDC. And regardless of what you say about CDC, when somebody invites you, you're going to show up. So it's important that CDC has allowed us to do that in the main campus, because there's CDCs all over the city, and they could have said, do it wherever, right here and right now. So that's important. And I think that comes particularly through the leadership of Leandris LeBird. I want to thank her publicly again for her leadership. And last and most importantly, I want to thank all of you for being here, because you have a different way of looking at public health through the lens of public health ethics. And we have the opportunities to set the tone and set the pace. And again, I thank you so very much. And I just heard a 3:30 bell go off. So we did it, and thank you so very much for showing. We're now dismissed.